70% of people with hypertension do not know they have it, not because they have not seen a doctor, but because hypertension produces no symptoms. It does not hurt. It gives no warning. It works silently for years, damaging your arteries, your heart, your kidneys, and your brain. And when it finally gives a warning, with a heart attack or a stroke, it is sometimes too late. I am a doctor, and today we are going to cover everything you need to know about hypertension and cardiovascular health. From what blood pressure actually is to how to measure it correctly at home, what to eat, what exercise to do, when you need medication, and which warning signs you should never ignore. If you have not subscribed yet, do it now. I publish unfiltered medical content every week. First, how your cardiovascular system works. Let us start with the basics. Your heart is a hollow muscle the size of your fist that beats around 100,000 times a day, without rest, without pauses. In a lifetime of 80 years, it pumps approximately 53 million gallons of blood through more than 60,000 miles of blood vessels. Blood pressure is the force that blood exerts against artery walls. It is measured with two numbers. The top one, systolic, is the pressure when the heart contracts and ejects blood. The bottom one, diastolic, is the pressure when the heart rests between beats. Normal is below 120/80. Between 120 to 129, with normal diastolic is considered elevated. Action is already needed. Between 130 to 139/80 to 89 is stage 1 hypertension. Above 140/90 is stage 2 and almost always requires medication. And above 180/120 with symptoms is a hypertensive crisis. Emergency care immediately. The problem with hypertension is that the damage is progressive and invisible. Every time pressure pushes hard against the arteries, it damages their inner lining. Cholesterol deposits build up at those damaged areas, forming plaques, a process called atherosclerosis. The plaques narrow the artery, and if a plaque ruptures and forms a clot, heart attack if it is in the heart, stroke if it is in the brain. Second, the risk factors you can change. There are hypertension risk factors you cannot control: age, genetics, ethnicity, but many are within your power. The first and most important, excess salt. The WHO recommends less than 5 grams per day, 1 teaspoon. Most of us consume double or triple that, and 75 to 80% of that sodium does not come from the salt shaker. It comes from ultra-processed foods, industrial bread, deli meats, aged cheeses, sauces, tinned foods, fast food. The second, physical inactivity. Regular aerobic exercise can reduce systolic pressure by 5 to 8 millimeters of mercury, as much as many first-line medications. The third, excess weight. Every kilogram of abdominal excess weight raises pressure. Losing 5 to 10% of body weight can reduce systolic pressure by 5 to 20 millimeters of mercury. The fourth, smoking. Nicotine acutely raises blood pressure with every cigarette and chronically damages the vascular endothelium. And the fifth, chronic stress. Continuously elevated cortisol activates the sympathetic nervous system and keeps pressure elevated. It is not a minor factor. It is one of the most frequently ignored. Third, how to measure blood pressure correctly. This chapter is especially important to me because 30% of people measure blood pressure incorrectly and get readings that do not reflect reality. First, sit and rest quietly for 5 minutes before measuring. Do not measure after exercise, coffee, smoking, or an argument. Second, sit correctly. Back supported, feet flat on the floor, arm at heart level. If your arm is raised or hanging, the reading will be inaccurate. Third, place the cuff directly on bare skin, 2 centimeters above the elbow crease, never over clothing. Fourth, take 2 readings, 1 to 2 minutes apart, and use the average. And a very important topic, the white coat effect. Up to 30% of people have higher blood pressure at the doctor's office than at home, due to the anxiety the clinical environment generates. If your doctor tells you your blood pressure is high, measure it at home for 7 days, morning and evening, and bring that record. It is far more informative than a single clinic reading. Always record the date, time, which arm you used, and both readings. That record is a gift to your doctor. Fourth, heart-healthy nutrition. The diet with the greatest scientific evidence for reducing blood pressure is called DASH. Dietary approaches to stop hypertension. Clinical studies show it can reduce systolic pressure by 8 to 14 millimeters of mercury within weeks. That is as much as some medications. Its principles are simple. Increase fruit and vegetables to 8 to 10 servings per day. They are rich in potassium, sodium's natural antidote. Potassium helps the kidneys eliminate sodium and relaxes arterial walls. Banana, avocado, potato, spinach, legumes, tomato. Add low-fat dairy, 2 to 3 servings per day. Calcium and magnesium have demonstrated antihypertensive effects. Include whole grains. The fiber reduces LDL cholesterol, which is the one that damages arteries. Use extra virgin olive oil as your primary fat. Its polyphenols have anti-inflammatory effects on the vascular endothelium and dramatically reduce salt, less than 5 grams per day. Read labels. Look for products with less than 120 milligrams of sodium per 100 grams. And when cooking at home, use herbs, spices, lemon, and vinegar instead of salt. Fifth, exercise and the heart. Exercise is one of the most effective medicines in existence for the heart, and it requires no prescription. Moderate aerobic exercise, brisk walking, swimming, cycling, practiced regularly reduces systolic pressure by 5 to 8 millimeters of mercury, and its effects go far beyond pressure. It reduces arterial stiffness, improves vascular endothelium, lowers LDL cholesterol, and raises HDL, reduces chronic cortisol, and improves insulin sensitivity. The WHO recommendation for adults is 150 minutes of moderate activity per week, 30 minutes, 5 days a week, or 75 minutes of vigorous activity if you prefer shorter, more intense workouts. If you have hypertension and have not exercised for a while, start by walking. A goal of 8,000 steps daily is achievable, sustainable, and has demonstrated cardiovascular benefits in large cohort studies. An important warning: if your pressure is above 160 over 100, consult your doctor before starting intense exercise. And if during exercise you feel chest pain, disproportionate shortness of breath, or intense dizziness, stop immediately and seek medical attention. Sixth, antihypertensive medication. Now let us talk about medication, because there are many myths around it. Myth 1. Taking blood pressure medication is a failure. No, it is a medical decision based on overall cardiovascular risk. When lifestyle changes are not sufficient, and in many cases they are not, medication is safe, effective, and life-saving. There are several groups of antihypertensive drugs. The most used are ACE inhibitors and ARBs, which block the renin-angiotensin system and relax vessels. Calcium channel blockers that directly relax arteries. Thiazide diuretics that remove sodium and water, and beta blockers that reduce heart rate and force. The choice of drug depends on each patient, age, other conditions, other medications, tolerance. It is an individualized decision made by the doctor. And the most dangerous mistake, stopping medication when you feel well. Antihypertensive medication does not cure hypertension. It controls it, like insulin in diabetes. If you stop it, pressure returns, and sometimes suddenly, with real risk of heart attack or stroke. Never stop or modify medication without talking to your doctor. 7th, warning signs you should never ignore. And now, the most important part of this entire video, the signs requiring urgent medical attention. Not tomorrow, not next week. Now, call emergency services if you have chest pain, especially if it radiates to the left arm, neck, or jaw. That may be a heart attack. Call emergency services if you suddenly cannot speak properly, cannot understand what people say, or have weakness or paralysis on one side of your body. That may be a stroke. And in stroke, every minute counts. Literally. For every minute without treatment, 1.9 million neurons are lost. Use the FAST rule to recognize stroke. Face. Is one side of their face drooping when they smile? Arms. Can they not keep both arms raised? Speech. Is their speech confused or slurred? Time. If any of these signs appear, call emergency services immediately. And if your pressure exceeds 180/120 with symptoms like severe headache, blurred vision, or difficulty breathing, that is a hypertensive crisis. Emergency care immediately. For everything else, get a blood test with a lipid panel and fasting glucose at least every 3 to 5 years if you are a healthy adult. Measure blood pressure at least once a year. And if you have diagnosed hypertension, get an annual eye examination. The retinal vessels are the only vessels in the body we can see directly, and they reflect the state of vessels throughout the body. Tell me in the comments, do you have a blood pressure monitor at home? Do you measure your pressure regularly? It is one of the simplest and most revealing questions I can ask you. And if someone in your family or close circle has hypertension, share this video with that person. It can make a real difference. If you want all this information in a format you can consult whenever needed, with blood pressure value tables, the complete diet principles, the exercise guide, the full medication section, and the warning signs protocol. The complete ebook is available. It is called Cardiovascular Health and Hypertension, the definitive guide. Written by a doctor in accessible language with no commercial agenda. The link is in the description. Subscribe for more real medical content. See you next week.